Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, scars, pigmentation, and I do a lot with facial balancing. I'm going to walk you through this case. I'll wait a few more moments for everybody to join us because I got a little bit late tonight with technical issues. So I'll wait for a few moments. For those who were waiting for me to get my mics fixed up, I appreciate you. And hopefully everyone can hear me now. But I'll walk you through this case. Really, it's a really cool case. This is a case of a patient who is just really excited with the fact that we were able to solve her melasma, solve her pigmentation, and you can see the skin quality itself is improved as well. And it's somebody who a lot of people would say you can't do lasers, you can't do energy devices on, but clearly we were able to do it. So it's a really, really awesome. It's a really, really exciting type of thing what we could do over and over and over again for a lot of these patients that have been told that there's really no hope for them. There's nothing they could do. And here we have something that, look at, we could do it. It just requires a lot of patience. It's a lot more patient than you may expect. It's like a lot of people think that this is something that with pigmentation, you just sort of zap it and it goes away. But in darker skin types, it's slower than you may expect. It's not something you can rush. You could really run into more rebound pigmentation if you rush it. You could run into issues where you could lose pigmentation if you use too much heat, too much energy, things like that. So got to go really, really slow, really careful when you're doing this. Otherwise, yeah, you are going to run into problems. There's just no way around it. And I love it though. It's like, I actually, you guys know I showcase a lot with acne and scars, but I actually really love pigmentation as well. It's really where I started doing a lot of things initially because I wanted to make sure that when I do things with lasers and energy devices for darker skin types, especially for scars, I wanted to make sure that I could do it in a safe way and really understand pigment at a really, really high level and learn how to manage pigmentation issues if they do occur. And I think that set me apart really quickly from a lot of different practices that when I was basically trying to solve my acne and my scars, I was told over and over, you can't use certain energy devices, can't do this and that. But there are ways to do it. It's just a matter of going a lot more patient than you may expect. Anya is saying, if I wanted to laser off deep hyperpigmentation and scars, what do I ask for? Well, it depends on what kind of pigmentation. So this kind of pigmentation, you could take a look and see. It's like this blotchy appearing pigmentation. I'm not sure if that's what you have, but you can see it's like blotchy and it's not like uniform. A lot of times it's a mirror image. Basically, you'll see like this blotchy patch on one side of the cheek and a blotchy patch on the other side a little bit. You can see on the forehead as well. And she's actually not even finished with her journey, but this is more consistent with melasma. And so melasma really requires a really very different approach than more like sun damage, for example, just sunspots. With melasma, we have to really pay attention to the vascular component of it. There's basically this abnormal blood flow that's occurring, and we have to really remodulate those vessels. And sometimes that involves oral medications. There's definitely topical creams that are going to be helpful. Really strong sunblock, things with iron oxide are really useful. And those are things that really are going to set us apart really and making sure that we can get excellent results. And the people who follow along that protocol get it consistently over and over and over again. So it's awesome. And it's really, really rewarding. Just like we just got to make sure that you're doing these things. But sometimes there's this hormonal component too, and we have to take a look to see what elements are causing the hormonal fluctuations potentially. And maybe there's certain medications that we could back off on or so, certain forms of birth control, for example. But also what we did with this patient, the reason why she's really glowing and looking really really amazing is because we worked on it with the Pico laser, and we were able to do that. This is, again, in the middle of her process. This is about 4 months into it. But I wanted to show it. I appreciate you, how is young guapo. I really appreciate you always giving me the positive feedback every night. Thank you so much. Jack Bautista saying, would you recommend in-person consultations or virtual consultations for scarring? It doesn't matter really. We could do either option. I'm totally comfortable doing either way. So if you're doing virtual, I'm going to circle all the different scars that you have, or zoom in on the type of scars. And I want to make it pretty clear that I could see those things really, really well. And if I'm not able to see it, I'll have you kind of test with the video and double check things. If there's any question about certain things, I'll say this will make as a game time decision for one or two issues. But otherwise, it's pretty clear what we could do. in person, it absolutely is excellent because we could also just, feel your skin, touch your skin, and really give you an idea in terms of how much volume loss you may have and what other steps you may need. But for that first initial portion, it really is pretty straightforward for us to be able to do with virtual consultation. So if you want to do virtual, it's no problem at all. Unbu is saying, hey, the beef tallow is working really well. Remember I told you I would try it. How long have you been trying it now for? That's awesome that it's already working for you. How is Pico laser different? Pico laser is really rapid. Basically, there's different forms of Pico lasers. I use two different forms. I use 1064 wavelength, and I also use a 755 wavelength. The 1064 wavelength goes a little bit deeper, so I get that deeper pigmentation. And then I use something called Pico Shore Pro, which is a 755 wavelength, really rapid, so it doesn't overheat the skin. And now we can go right on the surface, even in a darker patient like this, and we're able to break up a lot of that pigmentation really safely and really well. So it's pretty amazing that we could do it that way. And for some patients, we may only do one way or may do another way. It just depends on how deep your pigmentation is. So when you do the initial consultation, I'll really go through the depth of your skin, the pigmentation, and give you a good game plan for that. It's Topia saying that they're going to see me on Sunday. I'm not sure about that on Sunday, but I'll look forward to seeing you soon. Let's see here. Do younger people get better results? How soon after scars should you get treated for better results? It's not that necessarily that it's a better result per se, but it may be a faster, more robust collagen response if you are younger. So that's possible. Patients in their 20s, for example, you could see it pretty quickly that like their scars improve. A lot of times they heal really fast too. So that's really cool too, which is awesome. And that's really rewarding. Let's see here. Mev is saying, I have an appointment with you in June. Looking forward to it. Look forward to it too. What are you doing actually what are you planning on doing actually with us? Pigmentation or scars or acne? Hi, Dr. Gandhi. Good seeing you on, by the way, too. Jack Bautista is saying, how far out in advance are you usually booked out after consultation? Usually a few months, but you can always go on the list really for cancellations. Like there was a cancellation like a couple weeks ago or so, and then someone else jumped into it. Sometimes there's like emergency situations or so that people have to change, and so you may be able to do it that way. You could also actually, sometimes what people have done is they've purchased a few, if they have a certain day that they have to be on, they could schedule a consultation, also talk to the team and actually just book a few different things on there. And then we would, essentially if you set it up originally that this is the date that you need to be able to do it, and we could try to see if we could accommodate for that area around that time. So talk to the team after you schedule a consultation and see what we could do to help you out there. I try to get it so that everybody can be accommodated. But sometimes it really is like a matter of that, I do take a lot of time sometimes with some patients, and it's like, I have long hours because it's just like, I got to make sure everything is done properly. People fly out from so far away. One of my patients today, she came all the way from Tampa, and it's like, I got to make sure this is just like, for everybody, but it's like, I just got to make sure it's done like so properly and so perfectly, especially seeing you for the first time, assessing your skin, going through it, everything. And then sometimes there's just more complex scars that I have to really go and that like each individual line there. It's more time consuming than people may expect. It takes a lot of concentration, a lot of focus, but I'll tell you, like every time I'm going to do this, I'm going to do it for you like that. So it's like, whatever it is, we'll get you through it. And sometimes there's a bit of, sometimes there's a bit of a delay with us being able to see you because with all the patients that we have to do, we also have to do our other patients. They get a bit of a priority for seeing them to make sure that we could do the follow-ups for them, make sure they're safe. We also have to make sure that we could put them in the schedule really well, so that we could do the next step for them as well. And sometimes, that may mean that newer patients, we have to push back a little bit further. So do your consultation, just go through drqazi.com. We'll be happy to help you out, but it sometimes just takes a little bit more time. Also appreciate everybody who waited for me to come on because it took me a little bit longer to come on because of the technical issue right there. So thank you so much for that, by the way. Let's see, your best sunblock to prevent tan and damage. So the best one I found is Miso Aesthetics. Really, I do find it's the best one because it has a really high concentration of iron oxide. Really impressive, actually, the amount of iron oxide that's in there. And I really haven't found other brands really using that. So that's the thing. So I do think that that's really the thing that I would appreciate for a lot of people to have basically a sunblock with high concentration of iron oxide. Really useful. I do believe, I mean, I use chemical sunblocks sometimes too, but physical sunblocks especially are very, very helpful. So there's other options for more physical options that you could do, like zinc oxide, titanium oxide only. But I like the mesoaesthetic blend. It works out really well, good consistency for patients. So that's awesome. Liz is saying, hello, doctor. Are early fresh acne scars able to be reversed with topicals? It's possible, it's just that you start with retinoids and you could try to see if that's going to help out a bit, but I'm not so sure if it's going to like solve, if it's like deeper, but if it's like fresh, relatively superficial, possibly. Freddie's saying, hello, doctor. Really appreciate your work and videos. Appreciate you too. Thank you so much. And thank you all of those. I'm up and saying you're awesome, man. As I said before, us locals are blessed to have you. Appreciate you too, actually. Thank you. And Vinod is saying, hello, Dr. Qazi. I met with you today and your clinic is incredible. Thank you very much for taking the time to answer all my questions. Thank you so much, Vinod. That really means a lot to me. I know that a lot of people, and thank you, by the way, where you came from. You came all the way from Arizona to come all the way out here. So I really, really do appreciate you coming out. And it's like a real pleasure and a really a big honor for me to be able to treat patients from all over the world and from all different kinds of skin types. And I really do think that it needs to be brought to everybody, and like just I wish it was just more accessible to everybody, really. Hopefully there's things in here that people could get and learn and see that, okay, there's ways. I've had actually doctors reach out to me from India, for example, and from Kazakhstan the other day. And a lot of, like, I think you guys may have seen that physician, a lot of different, like from all over the place. And I'm happy to really help out with this because I want people to have a bit of a demystifying effect for acne and for scars. So there's a bit of this barrier is just broken down. People are more open and talking about it, and people could see what other people had to go through just to get to that great skin. It took a lot of work to do. It took a long way to basically get to results for patients sometimes. And people should know what the journey is for everybody. It's like it was a long emotional toll, and not everybody's cut out for it, really. And the people that did it, the people that are going through it, it's like you really have to, commend them. You have to really admire the fact that they did this. And I appreciate it, and I pay attention to it, and I really, really do care about it. I wish that like I could just do it for everybody all the time. It would just be like that's like it's awesome. And so I mean, part of what I'm doing in this whole thing too is I do actually want to say that like I do kind of find that I want to make it so that we could have it so that it's a little bit more selective. Really, that like some patients really, really need to come in, and it's like if you find that like certain things that that we're looking at, certain things that I'm doing, you want to go somewhere else, feel free to do that. Try somebody else, because I have a lot of patients that I want to be able to help, a lot of people that I want to do this at a very, very excellent level, and I'll do it. I will make sure it's done. I'll run through walls to make sure patients are like have excellent, beautiful results. So it's like it really should just be for certain people though. That's what I feel with this now. It's like I really do just want to make this so that it's really like for certain people now at this point. It's I'm not trying to like raise prices like at an exceptional level or anything like that, but like I just want to have it. This is like the people that deserve this and like want this and like want to get like their skin better and better. Like I'm going to help you out, and I will do it. I will go through everything that we need to do to get this the best possible result with that, and we will get there. And really, it's possible. It really is possible. Over and over and over again, I should show that it's possible to do it. Over and over and over again. Nobody else has shown that. And like, we'll do it. I will be happy to help you. Let's see here. Levy was asking, hi, does BBL laser work on post-inflammatory hyperpigmentation? So the question is with BBL broadband light, or sometimes IPL light, for example, as well. Basically, does it help with post-inflammatory hyperpigmentation? The concern is that with broadband light, BBL, it's not the best potentially for patients of melanated skin, darker patients like this patient, for example. You could easily get rebound pigmentation with that. Pico laser is better. You could even, I don't use Q switch, but you could even try Q switch in Fitzpatrick 4, potentially 5. But Pico laser is really best, Fitzpatrick 4 through 6, for post-inflammatory hyperpigmentation. Even lighter skin types, there's really less chance of that rebound pigmentation. So BBL, okay for a little bit of that, but like it has some contact cooling, which is nice. And then you're going to probably want to be on some sort of tyrosine kinase inhibitor, like maybe hydroquinone, for example, or so. But whether or not it's going to be enough for pigmented patients, doubt it because you're not going to be able to use too much energy. And if you use more energy, you could actually get rebound pigmentation. So that's the problem. And it sounds like you were suffering from that. That's why I wanted to get you that question, answer that question for you. I'll be on for a little bit tonight because I'll go on until like 10 tonight because I came on a little bit late though, just so you know. Let's see here. Where was I at? For melasma, what's my go-to treatment? Good question. I mean, the biggest thing I was talking about is essentially we got to make sure that we're using a really strong sunblock. We got to make sure that we're using some sort of tyrosine kinase inhibitors. Sometimes it involves hydroquinone. It could be also actually Eucerin's anti-pigment cream actually works really well. So you could do that as well. Sometimes you do oral tranexamic acid or topical tranexamic acid. The oral form is better than the topical form. And then you use lasers, and if you need to, if it's like a stubborn, it's a persistent type of melasma, it depends on what you're looking at, the depth of it, then you can use a laser, like for example, like the Pico laser. Zane is saying, can I kindly get your thoughts on serial punch excision on a surgical scar? It's located between both eyebrows. The area is very wide. A 1.5 millimeter punch across this will suffice. The thoughts on doing it. It's a really tough spot because there's a lot of contraction over in that area. So serial punch excision basically would take out a little bit, wait for a few weeks or months, do it again, wait for a little bit, do it again, keep on doing this and see if the scar is rising. Usually I'm a little slower actually. I'll wait 3-6 months or so. Actually, it could work very, very well. I do want to test the area to see how much tension there is. So for example, in like the cheek area, there's a patient that I was working on recently. I was doing it actually a few times like this. I was every 6 months, even once a year or so. It's incredible results, actually, incredible improvement with that. I do still use a laser because as it gets more superficial, we could cut it down now a bit more. But yeah, you could do that. In this area though, it's a tricky spot because of movement. So definitely want to make sure that you freeze these muscles, the corrugator muscles, that whole glabellar area, really freeze it with Botox, Dysport, something like that, so that there's not enough contraction over there. And just do that really for about a year and a half while the scar is healing. So that's really something you could consider. But you may not even need serial punch excisions. Maybe what you do is like a single punch excision, although in this area, it's questionable if you really want to do it that way, or just do lasers and fillers, for example. It may not necessarily be that you do excisions right there. So it's a spot that maybe I wouldn't do it there. Leslie is saying it's still in pause. That video is paused. Are people saying it's in pause right now? It looks like it's not paused. You guys would have all said it was paused now. So I'm not sure if that's the case. If it is paused, let me know. I don't know. Maybe you can't tell if it's paused. It looks like everybody's saying things, so I don't think it's paused right now. Maybe it's just you, Leslie, you're on Wi-Fi. Sorry about that. Let's see here. Any recommendations for purple vessel flare-ups? Yeah, so you could actually do. One of the better things to do is actually you could do a V-beam, or you could do Derma V, or you could consider doing XLV. So all options potentially for that, but double check also to see why is it flaring up. Is it really actually double check to see, is it really, sometimes there's broken capillaries on top of it there, and we may have to see if there's something else that's potentially triggering this. So one thing that I want to say is a lot of times like more like conservative approach with any times with like vessels or pigmentation could be a little bit better than like jumping at like lasers. If you need to use a laser, sure. But occasionally, sometimes actually just more conservative approaches could actually work out for a lot of types, especially there's somebody else who was asking about post-inflammatory erythema. And if it's more like just like after after a laser or after acne, really what you could do is more just like azelaic acid, just do low dose, 10% azelaic acid. It works out really well. So yeah, I think you were Jasmine was asking, I'm not sure if you're also asking about the other question too, but for broken capillaries, easy thing to start with is this 10% azelaic acid. Also do sunblock, make sure that it doesn't get pigmented that way. And then if it's still stuck, then yes, we could do like XLV is what I use. You could take a look to see about doing V-beam as well. All different options really for broken capillaries. But start with something like over the counter, 10% azelaic acid could work well. Will Erbium laser help with spider veins? No, really, Erbium laser is basically, it's ablating water. So it's absorbing water in the skin. So it's not going to help actually for color like vessels. Not going to do anything for that really. And spider veins, you could do either, depending on the depth of it, like a 1064 wavelength if it's deeper, and then if it's more superficial, potentially you could do something like a 532 wavelength. It depends on the depth though. Let's see here. I've done, where's the thing here? I missed a few questions here. Could tretinoin cause cold sore flare-ups? Yeah, I mean, really what could happen is that it could end up causing a little irritation on the corner of your mouth. And that anytime there's skin breakdown could end up causing actually a flare-up, for example, if you had the herpes virus in there. So you may need to do something to suppress that for a bit, and also do something to block that area with like Vaseline, really making sure that it doesn't really go into that lip area anymore. And you probably don't need to go around the mouth in general, just with your tretinoins. Let's see, where was that? Okay, so it looks like some person saying the surrounding of my mouth is darker than the rest of my face. What can I do? So it depends on if it's relatively blotchy or if it's more like a darker pigmentation, like uniformly around there. Sometimes that could be really something that you may have to do with, if it's more of a melasma type of blotchy type appearance, we may have to do suppressants like hydroquinone, for example, with the Pico laser or oral or topical tranexamic acid. If it's post-inflammatory hyperpigmentation, it may be a little bit easier, and hopefully it doesn't really come back if you use more sunblock and really just use like a lighter tretinoin or retinoid in the future. Let's see, how far out, where are we located? We're in Newport Beach, California, so Orange County, California. How do you know what type of scar is tethered? Is subcision the best for that? So when you smile, you'll see patients that like actually had a really, really great case the other day. It was like perfect because there's indentation there, but just from fat loss. But like really when he smiled, it just went so deep. It was just sunk really, really deep. And we had to break that up really, really well. And like, that's extremely successful for him. So it's like, that's like where it is. It's like, sometimes it's like a lot of times you could just see when people animate, when they're smiling, and you could see as I'm pulling on the skin, how this tension is in the skin and how much it's pulling down. And, you could test it yourself to see when you're looking at the mirror, see, okay, you're smiling, and is the skin kind of folding around the scar quite a bit? If it's a little pretty mild, you could probably just get away with just like a lighter laser. But if it's like a deeper, like it's pulling down quite a bit there, then you probably need to do something more with subcision there. What do you think of growth factors for scars? I'm open to it. I just haven't really found anything to, wow me or anything like this at this point, but I will take a look and see, if there's something out there that's really nice. I tried a few earlier on, like several years ago. I tried a lot of them actually. Didn't really find them change too much, really, to be honest with you. So that's why I didn't really love it. The Megaloelectric is saying, your approach with phenol peel is very conservative. Why not patch test phenol peels on a small place to go as strong as you can? Good question. So I don't think that there's much utility to patch test as you may think. There's different thickness in the skin depending on the area that you're in anyways. But if you are lighter Fitzpatrick 1 through 3, I may not have to go too conservative. I wouldn't say this is a very conservative approach. I do a medium depth form for Fitzpatrick 4. So it's not exactly very conservative, but we could go stronger for lighter skin types, Fitzpatrick 1 through 3. In fact, I have a case that's going to be coming up with a Fitzpatrick 2 patient that I'll go stronger on. And it depends on how thick the scars are. So there's a lot of different variables that are involved with it. It's not really going to actually be about necessarily the fact that it's conservative or not. We do it in 2 steps. We do the phenol in one day, and then the next day we'll do more of like a mechanical dermabrasion and place some more phenol so it goes a little bit deeper. And then you could really test to see if it goes down to the reticular dermis actually very well if you want to. If you're open to doing a study, you could take a look and see like histologically that it goes down to that reticular dermis, which is nice, and we could get down to that deeper. So it's just a little bit safer. It's again a little bit slower, takes 2 steps, but it works out better so that we could do it in darker skin types that way. And some patients, have lighter skin types, so we can go stronger. Where was I at there? I missed so many questions, which I appreciate, but I know that there were a few, so I'll try to get to everybody's, and don't feel bad if I missed yours. I'll try to get back to it, and I'm also back on tomorrow anyway. So let's see here. How deep can acne scars be? Good question. I mean, there's some patients that really has completely destroyed some of the fat there. Is it really that it's like the scar is that deep? Not necessarily, but the scar destroyed so much fat underneath there. The cystic lesion destroyed so much fat that the bacteria did that, and essentially it looks very, very deep now. So whether it's from just the acne and the scarring and due to the fat loss, it doesn't really make too much of a difference because we have to solve both really. Oh, Gabe is on. Gabe is saying my skin is light again, so you can go hard. Awesome, Gabe. Good to hear. Good. Hopefully you're doing really well, by the way. Does CO2 destroy fat pads? I mean, it's possible because it's heat and energy. You have to use a lot of heat and a lot of energy. I'm really focused. Like the patient I was working on today, one of the reasons why I spent so much time with her, she had very, very thin skin, some thickness around the scars. And it took a while, really. I wanted to just make sure it was just like with a 1 millimeter, basically. I was just tracing around some of those scars. And I was just really finely just going down, really finely going down it. And that way I don't overheat the skin. And then the rest of it was just more of like a blended approach with the Erbium laser, which doesn't have much heat. When I do like a deeper form of the CO2 laser, it's for like some select areas, but not really like the full face like that. So unlikely to really have that issue because I'm not using bulk heat like that. Let's see here. For CO2, when doing scars, how do we know if you need, where did it go? How do you know if you need to adjust it or go deeper or more dense or both? I'm assuming you're a physician or so because you're saying for CO2, when doing scars, how do we know if you need to adjust it to go deeper or more dense or both? So good question. I mean, if you're looking at the videos I'm doing, you'll see when I'm going along like the edges of the scar. I'm really going through with sometimes an ablative form of the CO2 laser to soften those edges up. And I'm trying to get kind of pretty close to the depth of the scar that way. So that's pretty dense. That's a fully ablative form of it. And I'm really kind of basically slicing down some of that excess scar tissue there, really carefully, really meticulously slicing it down. I do it based on the depth of the scar, and I take a look consistently under angle lighting so I can see where that depth is and just go exactly at that layer. As much as I can, if it's safe enough for me to do it, I'll cut down to it. And really, actually, interestingly enough, this last month was really complex cases, actually, and everyone's been healing incredibly well. I've been following up with everybody for like the ones I did last month as well. Really complex cases, actually, very, very thick scars, and really healed very, very well. I was able to cut down to that layer very, very well. Some people did like their second step with that, and it was just like it was very superficial now, so we could cut it down very nicely. So it's a matter of kind of I guess the way to answer your question is I don't really do it based on like a density of the fractionated form of it. I don't really believe in it too much like that, where you just go really dense, deep, and very, very deep like that. I don't think you need that much heat, that much energy for the vast majority of the face. Just for certain select areas, we'll do it, and then we'll just sort of blend it in there. George is saying, I've been doing IPL for the face. I don't get any reduction in chin and upper lip. I guess you have to rephrase that question because I'm missing that right there. What happens if subcision is performed on scars that do not require this technique? You have to go to somebody who's good with it, really. You have to be really careful, really meticulous when you do subcision. It could sometimes take a long time. Sometimes it's just like, we mark it and it's just like 1 or 2 areas. But sometimes it's like those 1 or 2 areas have like a lot of bands, and you're going in each individual band, and you're just focused on each individual band. It doesn't matter, per se what kind of tool you're using. I usually use a blunt cannula, but as long as you're really like focused on each individual spot, it's really important for us. And just like you could really feel the skin and make sure you're just going at each of those spots. It's in terms of rather healthy tissue, it's going to cause a little bit more swelling, a little bit more irritating, especially if you're using more like sharp tools over there. But if it's a blunt cannula, that's something you could go in there pretty nicely. It really does push away a lot of those vessels, and you don't really run into many issues with it. But I definitely would not recommend somebody like basically using like this windshield wiper approach in like healthy tissue. A lot of times that they do in areas that maybe really could cause problems. One of my patients today, actually, he was telling me he's on right now, but he said he did it elsewhere, and he did get sagging. Somebody had done a form of subcision on him, and ended up causing that for him. And it's unfortunate because it could happen like that for people when they do it a certain way. So you got to be very, very precise. There has to be a lot of precision with a lot of these things, and it takes more time and effort than people may expect. It does. It's like we got to be focused on this stuff. And hopefully there's no more lag on IG. Hopefully you guys are saying okay. Let's see, where was I at there? And which lasers are easiest to treat? Ice pick, boxcar, or rolling? Good question. I mean, okay, so it depends on the depth for all those things. Personally, I do really love rolling scars in a way, actually, because when I love doing that subcision portion because you could feel that break up really, really well. And then we wait like a little bit of time and you could start putting a little bit of volume in there. And over the course of like a year and a half or so, giving you back that volume, it was incredible the amount of improvement that you could get if it was just really just a rolling scar like that. It could be awesome actually for patients just over time, just like you could see that like this looks really amazing. Just we're continuously putting some volume in there, and it was a volume loss issue. And because I could do the subcision so effectively, we got that really, really well. So I think like probably rolling scars, probably.
Daddy,
I,
Mama,
I,
Mama,
I,
Mama.
I